Good morning.
Good morning, my internet friends. Welcome to the Medicare Cafe pre-chat with your host. My name's Olivia Richardson.
And I'm Carrie Vogt.
I know.
Sorry, I was making sure the audio was on.
We did get the audio this time. We are professionals because we checked half the things that we should have. So good for us. But welcome everybody joining the pre-chat. This is where Carrie and I log on just a few minutes earlier and just kind of talk about industry updates, things that happened this week, or if you guys have any questions, make sure you can text this number below or comment on the, how do you do it? Like,
I don't know.
I feel like a weather lady that's like, oh, and back here, there's an orange front coming in. Or you can message us or comment on the video. We're more than happy to talk to you there. So on that note, a couple of things. So you pointed out the SEP for Part B.
Yes.
Which sounds exciting.
There was one of my clients emailed me yesterday that there's a deadline. She got an email from CMS saying that the deadline for Part B enrollment, all right?
Mm-hmm.
That the deadline. You caught it. You caught your coffee.
I'm new here.
The deadline for Part A and Part B enrollment has been extended until the end of this year, literally because, as it says in their email, if you've had trouble contacting us by phone, which I don't know the last new client I got that has been like, oh yeah, it was a smooth process enrolling A and B.
Everything was super easy.
Everybody has been like, I've been on the phone with Social Security for 3 hours, and if I want to set a phone appointment, it's 3 months in the future. So CMS basically sent out a notice saying that they're extending that to the end of the year if you were having trouble getting a hold of them by phone. But like Olivia just said earlier when we were talking, it doesn't really mean that much.
Yeah, so again, it's all about, like you said, Social Security since COVID. Fewer employees, less face-to-face appointments. They're not taking. I think most of them opened up, but the phones have just been overran.
Yeah.
You mentioned it, 3-hour wait times. No one is going to do that. So.
And also at the same time, like more people turning 65 than ever.
Right. Oh, for sure. Yeah. It's literally the perfect storm for just what exactly we're seeing. Chaos. And so with that, again, and this is an SEP that's only good for Medicare enrolling into Medicare Part A and Part B if you missed an enrollment period. So if you were, again, didn't have it and tried to use GEP, the general enrollment period, or if you turned 65 and could not get enrolled in that time, then you do have this election. They'll typically backdate it. Like if you enroll during the GEP, you won't get it effective until January or till July, just like anything else, but they'll backdate everything else. It doesn't open anything for an SEP for Part D or Part C. So it is strictly just using the enrollment into the A and B stuff. So we'll see. It is, again, kind of CMS saying like, hey guys, our bad. We understand it's not easy out there right now. But, on the other front, and again, we don't have a ton of time to talk about it this morning. On the other front, everybody's right now buzzing about the major changes that came out compliance-wise and all the updates on the amendments. Again, the Medicare Communications and Marketing Guidelines got updated a few weeks back. And so in addition to, again, CMS saying like, hey, seniors, we understand Social Security's messed up, but also agents kind of like now screw you on this front too. So a lot of questions about what agents are going to do. Just a reminder, really, there are 3 main parts to the compliance update. Number 1, any call you have with your clients that results in a sale has to be recorded. So even
for like 10 years.
And recorded and stored for 10 years. So even you, like a lot of times if a client's calling you, asking you Medicare questions or calling to set an appointment, that is part of the chain of enrollment, that has to be recorded and stored for 10 years. So we're working on solutions for that. Stay tuned. The second part of that is that there is now like a 13 to 15 second disclaimer that has to be said before you enroll somebody into a Medicare plan. And that disclaimer,
all of them?
It's specific,
MedSups too?
Specifically for MedSups and PDP, but if you're doing a MedSup, you're going to be doing a PDP.
Right.
And that disclaimer is like 15 seconds long, and it basically, the part that's like, says that I do not represent all Medicare Advantage or prescription drug plans. If you want a list of all plans, if you want to look at all plans available in your area, call 1-800-MEDICARE or go to Medicare.gov.
What?
That is now the disclaimer that you have to say at every phone call or in every appointment. And the third one is
my
going to be,
goodness.
again, making sure that you can track the entire, this one's not new, came with the update October 8th, but making sure that you can track the entire chain of enrollment, which means that you have to keep all marketing pieces used for that client acquisition for 10 years. So any lead drop, internet lead, Facebook lead, you have to have that on record, what that actual lead looked like for 10 years.
Deep breath on all that.
Yeah, so we do have some, like, again, having some tools come up to kind of help fix that.
I was going to say, Stacy just asked if Integrity will supply a tool for agents to record and store the
They're
call.
actually working on that through Medicare Center. Currently, Medicare Center has the capability of doing the voice recording for the signature side of it, because they were saying the enrollment has to be done over the phone, has to be recorded. They have incorporated that. It is, now that they know, like, hey, this isn't going to cut it, you need more, they are working on bringing on a capability of recording the whole conversation. So more to come. Storage is really going to be the issue with that, because even in that method, they use a third party called, like, Tilio or something like that. I can't remember the name, but it doesn't allow the recording to be available. It's just archived.
And I imagine before you record, you have to tell the person this is being recorded.
Depends on the state you live in, to say, because like in Missouri, you can record somebody and they not know. You can do a one-side recording and they not be aware of it. But states, that's such a state-by-state regulation, and it's really easy, again, on those calls to do like this call is being recorded for training and content, and quality purposes. So more to come on that. We have several videos out right now talking about these compliance updates, and we'll be doing some more videos of talking about solutions for a lot of this stuff. It does bring a lot of opportunity. It's really easy to focus on, like, man, this sucks. But if you think about, like, how it's going to affect the industry, it will absolutely kind of weed out some of those baddies.
True.
So it will be good opportunity.
Will be a good thing. Just got to figure out a few things.
So on that note, because I don't like talking about things that are frustrating and sad, I'm going to actually bring back everybody's high school nightmare.
Yay!
And do our Medicare Pop Quiz Part 1. And if anybody's upset about this was Carrie's idea, but I do support it fully. So Carrie, tell me a little bit about why, first of all, my name's Olivia.
I'm Carrie.
Tell me a little bit about, like, why you wanted to do this.
So we had a team meeting, I guess a couple weeks ago. Maybe it was just last week. And
time doesn't exist.
Our like team managers put this piece in front of us and said Medicare Pop Quiz. And the nerd in me, I was like, yes.
You were that kid in class that was like, teacher, you didn't ask us to turn in our homework.
Okay, no, I wasn't that. I wasn't that girl. But I don't know. I don't know why I like being, like, put in check. Is that weird?
Put in check? No, that's just accountability. I love it.
And so, yeah, anyways, after the, like, 30 questions, I was like, Olivia, we should have a pop quiz on the cafe.
I love it.
So here we are.
I'll be the first to admit. So we're gonna go ahead and do this pop quiz. But whenever I was looking at the answers or questions, I was having to look up some of the answers, because these are things we specifically tell an agent, like, hey, you don't have to know the specifics of this because it will never affect your client. But it's just like, man, like, I really got lazy in my Medicare knowledge.
It's good to just store in that back, store in your back pocket for later.
Nerd. All right, guys, so if you do want to participate, we do encourage you, feel free to text the number below. If you do text us, we'd like it if you put your name in there so we know who you are. We will maybe having some fun prizes to send out depending on interaction, depending on certain questions answered. So it is in your best interest to play along if you're like watching the live version. If you're watching the recorded version, then you can still play along. You just no prize for you. So first question we have, guys, what is the Part A and Part B deductible? Now, I guarantee you a lot of our agents will know the Part B deductible because I know a lot of our clients are going to actively participate in that deductible. But that Part A, that was one that I was like, oh, I know it changes every year. What the heck is that? I have no idea.
When I wrote this down, I was off by $6. I was like, that's
by $6?
Isn't that weird?
That's impressive.
But like, I don't know. I just thought, like, $6? That's odd.
Good morning, Lisa. Good morning, Susie.
Good morning.
All right, so the answer to this, we got some texts, and none of them correct.
None of them are correct.
Go ahead and the answer to that, the Part A deductible is $1,156. That Part B for 2022 is $233. Again, a lot of your individuals, a lot of your clients will participate in that Part B deductible, so that one you should know off the top of your head. The Part A I can give you a little bit of grace for. And again, talking about not the Part B premium,
not the
talking
Part B
about
premium.
the Part
Sorry, we
B
just got a
deductible. Yes. The next question number 2 on this pop quiz. What is the standard Part B premium for 2022? That word standard there is going to be pretty important.
Absolutely.
Why?
The base premium.
And we'll talk about that. We're not going to say why standard is important.
Nope.
But it will be. Potential question coming up. So what is, and again, the Part B premium is another one that you probably do need to know off the top of your head, because all of your clients, unless they're on some sort of savings program, will participate in that. The answer to question number 2 is going to be 170.10. 170.10. That is the Part B premium. We'll talk a little bit more about how that is paid. The majority of individuals may not be super familiar with that because it does come, Crystal, good job. It does come directly from their Social Security account.
Yes, I was going to say I've had clients that have had no idea that they're paying that.
Right.
Because they've never seen it.
Yeah.
It's just automatically deducted.
We'll talk about when some agent or clients get mad about that, when they do get more invested.
Yes.
Right, number 3, how many IRMA brackets are there? And I will be the first to say I got this question wrong. I was looking like, oh yeah, this. I'm like, well, I'll just double check my work.
Sorry, someone asked us if we can turn up the volume. I'm not sure how to do that.
We can't on our end because our mic is super sensitive.
It comes in better over the phone.
Comes in better over the phone. Yeah, if it does come in better over the phone, it might be your system or your hardware's volume. If anybody else is having issues hearing us, please let me know. But again, that question, just to reiterate, how many IRMA brackets are there? And I got this one wrong.
There were some debates on my team with this one because I'll explain it.
Okay,
I'll explain it with the
moving
answers.
on to the IRMA brackets, how many are there?
So
6.
I said there was 5 because I was thinking like you have the standard and then there's 5, 5 adjustments.
Okay.
And so,
but technically there are still 6
Good
brackets.
job, Michelle. Yes, right. But when you look at the
Good
chart,
job,
there's 6
Michelle.
brackets. Good job, Michelle. Yep, there's 6.
So, and I actually wasn't even close. I said 3 because I was like, because I never like look at like the second half of it. When I see it, it's just the 3 on there. The 3 most common. Interesting fact: it used to be only 5% of people qualified for that higher level. That actually has gone up. So more people are qualifying for higher premiums than ever. Thanks, baby boomers, for making all the monies.
Making all the monies.
Question number 4. What parts of Medicare are subject to IRMA? What parts of Medicare are subject to IRMA? And again, this is something that you deal with a lot because of all your financial planning people.
Yep. So is it like Part A, Part B, Part C, Part D?
How many of your financial planners know the answer to this?
Good job, Crystal.
There it is, Crystal.
B and D.
Parts B and D.
So most of the financial advisors that I work with are familiar that they're B. But they're surprised when I say there's also one for D.
Interesting.
Yep, they don't realize it's 2 parts. Good job, Deb.
Thanks. Great job, guys. Next question we have. On original Medicare, what is the client's responsibility of the cost in a skilled nursing facility days 21 through 100? Wow, I cannot type or read.
Someone else said the volume is lower than expected. Okay. All right, so we are going to just speak up also.
I turned this up. Let me know if this helps or let me know if I just sound overly aggressive right now. Because either is a
So you turned something up?
I turned something up. I also may have broken everything.
I have checked all my sound settings, and I'm having trouble, too.
Okay.
All right.
Sorry,
guys.
Me know. Should be working now.
Yeah, we'll talk louder, too.
So what is, again, most your clients will have no idea because the average hospital stay is actually less than 7 days. So most people this is skilled nursing facility. Never mind. Skilled nursing facilities, again, on average, they actually get out before that 21 day, but sometimes that doesn't happen.
Exactly.
What can they expect to pay after the 21st day?
$194.50 per day. That's days 21 through 100.
Yes. So
someone said, I usually look at the MedSup book.
Yeah, the MedSup book is going to have a lot of this. Actually, most of these costs is so interesting is on the Medicare quick cost at a glance. There's a sheet.
Yes.
And people, because again, people like to go to the Medicare and You handbook for these specific numbers.
I love that cost sheet.
They're not in there because
Good job,
the Medicare and You handbook comes out in September.
Right.
These dollar amounts and premiums and deductibles don't come out until later on in the year. So this little Medicare cost sheet is a nice addendum that you need to have.
That is something that I have up side by side with my pathways. And again, I'm sometimes with more affluent clients, but I know I'm going to have the IRMA bracket chart out.
Oh, every time. Next one, how long is the benefit period associated with Medicare Part A? I'm not going to say this is a trick question, but like kind of.
Kind of.
Because it's not like, it's not like a set amount of days.
Right.
That benefit lasts.
Benefit periods I feel like can be tricky in general.
Yeah.
Just understanding them.
And it's different
Stacey
for
is
everything.
On it.
Absolutely, Stacey. So what
Stacey.
is the benefit of, or what is it? It is going to be until there is a 60-day break in receiving benefits. That is how the Part A deductible works. Can be confusing because I don't know of another deductible that doesn't go by like occurrence, but truly does go by benefit period. So 60-day break in period, that is how the Part A benefit period restarts.
Like the day you leave that skilled setting, the clock starts ticking.
Yes.
And if you don't go back within those 60 days, then you don't pay the deductible.
There you go. What is not considered credible coverage for Medicare Part B?
This is secretly my favorite one.
Really?
I don't know why.
Well, it's because it makes no
I think
sense.
it surprises people, and it makes no sense. I met with somebody. Good job, Michelle. You guys are on it.
I love it.
I met with somebody on, I don't remember what day it was last week, but they were just baffled that one of these was not considered credible.
It is, and it's really frustrating. And so what...
Good job, Michael. Yep,
what is not considered credible? Yes, Stacey, Michael, some more for you. COBRA.
It's the VA. I feel like that's the biggest one.
It gets everybody because it doesn't make sense. Employer coverage with less than 20 employees, ACA/individual health plans as well. And again, what confuses me with the ACA is that what's considered, you now have to have credible coverage with ACA, or you did to avoid penalties.
Right.
However, ACA is not credible from Medicare.
Right. It makes no sense.
It makes no sense.
And on the VA, so their drug coverage is considered credible. But it's not considered for Part B.
COBRA, the drug is considered credible.
That's what I think is just
but
bizarre.
Not for Part B. Makes no sense.
Employer coverage not as good as Medicare.
And again, when they say not as good as the equivalent value, again, that's that 20 employer and 20 employee rule. So let's get to our next question. Question number 8. What is the national average premium for 2022?
Did you have to look this one up, or did you know it?
I had to look it up.
I was close.
I had to look it up.
But yeah, I had to look this one up.
Which is really interesting. We do know that it changes every single year, but lately it's actually been going down. Which no other premium goes down. Yeah, every other, your Part B is going up, Part D is going up, everything is going up. The Part D premium national average has actually gone down.
Okay.
So very, very cool. What is the Part D premium for 2022? The national average that is. That number is going to be, drum roll. Can you Google fast enough? 3337.
I think it's on your end. Still getting sound issues, unless I'm the only one mentioning it. I just played some Tom Petty in another Medicare show, and they're both loud and clear.
Huh. Interesting.
Mariah said this was unplugged, I think.
Huh.
When she got in here.
Let me see this. No, this one's working.
Does that matter?
No, because that's our audio.
Okay.
It says it's working. We'll have to do some, I'll come back to us. We'll have to do some edits and figure that out. But it says everything's working on our end.
Michelle clarified that there are some plus 20 employer plans that are not credible.
I'd have to look into it. I've not seen any plus 21s. Unless there's again, it depends. If it's truly group coverage, it should be considered credible. There are some of those fraternity style plans.
Or if it didn't offer drug coverage.
Maybe that could be the case as well.
I can't think of any employer. I've never ran into that, but Michelle, maybe elaborate if you have a specific example.
Absolutely. Question number 9. We got 15 questions total for our Part 1. Question number 9. Why do you need to know the national average premium in 2022 for Part D? This is actually a two-parter. There are really, in my experience, 2 reasons that you need to know the national average. Because, again, reminder, every carrier can set their own premium, but...
And I only thought of one.
Oh.
So, yeah. But I don't run into the other one as much.
Right.
But still good for me to know.
Still good to know.
No excuses.
Yes.
Mandy says she can hear us just fine.
Okay.
Okay.
Nobody knows.
Nobody knows.
But it's provocative.
Yes.
So why do you need to know the national average premium for Part D? I don't think we have any guesses. Maybe we have everybody stumped. 2 reasons. 1, it will help you calculate the Part D late enrollment penalty, which is, again, 1% of that average per month that they were eligible for Part D but did not have that or any form of coverage. It also is the number of the premium of LIS that is covered when somebody qualifies for 100% of LIS. So if somebody is getting 100% LIS, meaning they qualify for 135% of the federal poverty level, if they're on a PDP plan that costs like $70, it doesn't take care of all $70 of the Part D plan. It only covers up to the national average. So most of that doesn't matter because they'll be auto-enrolled or enrolled into like a lesser premium plan. But if you have somebody on LIS and they're still paying a premium, either means that they're not 100% LIS or they were on a drug plan that cost more than the national average.
Michelle explained a little. She said Walmart has several plans for employees. Some of the more affordable might be the reason. In our area, 2 of 3 are credible. They must check with their HR.
Always check with your HR.
Yep, absolutely.
Also, if somebody's on a on a plan that is considered credible coverage, they will get a letter in the mail every September letting them know their coverage is credible.
What is that called? Is it the annual credit notice?
It's not on the pop quiz. I don't have to know. I honestly have no idea.
Notice of change?
And no, that's the that's the We'll look into that. That wasn't on the quiz. I didn't study that, Carrie.
Question number 10.
How many lifetime reserves days does a client get? So do you want to kind of explain what Stacy's killing it? Do you want to kind of explain what a lifetime reserve day is?
Lifetime reserve. You're putting me on the spot here. This is one that I don't know that well. I know. Lifetime reserve is if you've used all of those 60 days. No,
90.
90.
If you're in like a skilled nursing facility.
For 90. And you've hit that limit of what Medicare will cover, then you have what's considered lifetime reserve days, which is you get...
You get 60 lifetime reserve days.
And I think the payment of those, like you still have to pay.
It was 700.
Yeah,
something
700
plus.
something.
Yeah, it's
for each
crazy.
one of those days. So it's really high if you have to like pull from your lifetime reserve.
Doesn't happen very often, but like crazier things I'm sure have happened. Right. Question numero 11. What year did Medicare begin?
This is a good one.
Bonus points if you know. It's not a question. Bonus points if you know what the first Medicare supplement was ever written. What the first written Medicare supplement, what company it was.
I know.
What was it? Carrie.
Mutual of Omaha.
Mutual of Omaha was the first MedSup company ever written. But what
couldn't tell you what like plan it was.
No, I mean it was probably Plan like Monkey,
right?
Based on the Wild Kingdom, and then none of those plans exist anymore.
Side note: somebody at SBS that I was talking to last week used your 1 + 1 = fish.
Did they?
Yes.
I feel so honored because 1 + 1 = fish. I don't know how else to explain this.
Good job, Stacy. All right, Stacy, are you knowing all these off the top of your head, or are you Google works?
So again,
how easy is that to remember, guys?
65. You turned 65, and wasn't it under Harry S. Truman? I think that was Truman.
My team talked about this, and I think I was not paying attention.
I think it was Truman. That's another bonus point.
Whoopsies. I deleted something, I think. 1961. Close.
It was 1965. Medicare was short.
Arnie.
Their hair was
long.
Oh,
that's just your name.
Arnie.
I was like, wait, President Arnie? Not familiar with that one.
I would vote for
Johnson.
Arnie. President Johnson.
Yes,
thank you.
Yes.
All right, so the next one is going to be question number 12 out of 15. What are the 3 ways someone receives Medicare? And really by that was probably poor wording on my part. What are the 3 ways that somebody is eligible? Yeah. What are 3 ways that you can become eligible for being on Medicare?
And I kind of have one to add.
Ooh.
Well, it's kind of incorporated in your last answer.
Okay. I like it. Let's go into it.
Okay.
Answer. 3 ways.
3 ways.
Let's talk about that. It is going to be turning 65, disability, 24 consecutive months.
Yep,
that's something to be born.
Yep.
And then
end-stage renal disease.
I put it on here.
I was gonna say, I think.
No, it is. Ignore that. I'm gonna take it off.
End-stage renal.
Don't even look at it. It's end-stage renal disease or ALS. And with end-stage renal disease or ALS, it qualifies immediately. Disability, you have to be on there for 24 months.
And the Medicare kicks in on the 25th.
Nobody pay attention to the man behind the screen because she was wrong.
Go Sadie.
Yeah, and again, in order to get that Medicare Part A premium free is to be working for at least 40 quarters, aka 10 years into the Medicare system, or married to somebody. I did actually work one time with this person. I loved her. She was literally like my idol in life. And she didn't qualify for Medicare Part A premium free. And I said, how? She is like the most fabulously wealthy, sassiest individual ever. So I was doing some digging. Turns out she made a career out of being married and was never married to the same person for 10 years.
Oh, like her career was getting married.
Yes.
Oh.
And then she was constantly divorcing them. I'm spitting. I'm being really excited. I was constantly divorcing them and getting half of everything. So she had like 5 different husbands that she was getting like alimony and all this stuff from, but never was married to the same person for 10 years. So she didn't qualify for premium free Part A.
Oh my gosh.
So I was just like, fine.
There's an exception. There's that one person for everything.
Every.
Well, and I had somebody not too long ago ask me, who was a teacher, and they were like, does it have to be 40 quarters in a row? Does it have to be 10 years in a row? And I was like, no, just 40 quarters in your working history.
But when it comes to being married to somebody, you do have
it has to be 10
that
in a
person
row.
for 10 years. So she just couldn't do it. I'm like, hey.
Stacy says she was your idol.
I was just like, you don't know what you want. Some people can't decide on like a house they want or what dress they want to wear. She couldn't decide on a husband. And I think that's fine.
So I think
she was just
maybe
the sassiest.
This is maybe a pre-chat conversation, but I like, because so many ex-spouses are drawing off of an ex-spouse if they're never remarried. I think that's why Social Security is going broke. Like if you have had 3 marriages for 10 years,
you're getting
and they haven't remarried, you could potentially have 3 people drawing from your benefit.
Oh.
And people get married a lot now.
Yeah.
So just a
sidebar. Here is a question we're coming back to. How does a client pay for the Part D premium when they are not withdrawing Social Security? This is something we see a lot, especially people who are choosing to work past the age of 65, or again, they get that full Social Security at age 67. So a lot of them will say, well, I want to continue to build up my Social Security. So for 2 years, I'm going to do that. What does that even look like? How do they do that?
I think, good job, Crystal.
Yes.
I would say 75% of my clients are not drawing Social Security yet.
Really? Well, again, you're working with a lot of those higher affluent ones. So again, that answer is quarterly. One of the indirect payment, yes, Stacy, quarterly, get billed for 3 months at a time. And I'll tell you what, this is something that whenever I'm fielding questions from agents, we get agents calling in, they're just mad because they're like, this person is getting billed 3 times the amount. They don't qualify for IRMA. Their low income, like Social Security messed up, and we're like, well, actually, they won't have to worry about it for another 3 months or so. But yes, it is quarterly.
But check also, bank auto detection, says Michelle. I don't believe you can set it up on a bank auto draft. It has to be a direct mail. Oh, that made me lose my train of thought. I might think of it again. I remembered.
Okay.
I just had somebody who Social Security's bill was wrong. It was a May and June, like on the breakdown. It only said 2 months, but she was billed for 3 months.
Gotta watch them.
So don't just trust them. Government can make mistakes too.
That shocks nobody here. Next question. 2 more left, guys. What are the Medicare savings
this was one you
programs?
added.
Yes.
Take this one away.
This is one again.
No, I mean like you take it away. Not like take the question away.
It's bad. Screw that question.
Take it away.
That came from Olivia's brain. It can't be good. But yeah, what are the Medicare savings programs? Again, this is one that so many people qualify for Medicare savings programs that don't realize, because a lot of them they do have to actually like apply for. They don't just automatically get them. And the thresholds aren't nearly as large as what you would think. So there are 4 different types of Medicare savings programs. We're familiar with 3 of them, and 2 of them are kind of the same thing.
Yep.
So there are qualified Medicare beneficiary, aka QMB or QMB Plus. That basically means that individual has both Medicare and typically full Medicaid, full eligible for Medicaid. Specified low-income Medicare beneficiary means that, again, that is somebody who gets their Part B of Medicare paid for, so they don't have the premium associated with Part B. Qualifying individuals, this one is also Medicare Part B, but has a lower threshold than the SLMB, and you have to qualify for it annually, and not everybody will get it. It's basically when that money runs out, it runs out. It's really weird. And then qualified disabled and working individuals. That's one that is actually maybe a little newer. It's new to me.
I was going to say, can you explain that one?
I honestly can't. I don't know what it is. I will do some more research on it, but I was like, I knew of 3 of them. That 4th one, I was like,
how new is that one?
I don't know. So some research follow has to do. The qualified disabled and working individuals, don't know her.
So the QMB, SLMB, and the LIS.
So LIS is actually a federal program, not a it is a federal program, but it's ran like at the state level, so it's not a Medicare savings program run by a different side. But again, the QMB/QMB Plus, those kind of go in the same. SLMB, which is SLMB, aka Part B paying. Qualified individual also pays the Part B premium, and then this qualified disabled and working. Gonna do some research on that.
Do you know? There's like SLMB 1, SLMB 2. Do you know the breakdowns?
I don't know the breakdowns for
I
sure.
don't either.
No,
It's
such a crazy. And then there's QMB and QMB Plus means Medicaid level, and the Plus means full Medicaid, which again affects the qualifications for if they can get into a dual special needs plan.
So the QI, that is basically the same as SLMB, but you can have a higher income amount?
Well, yes. And SLMB is like once you enroll into it, you're there until your income kicks you out. Qualifying individual, you have to apply for it every single year. And the way that it works is like a bucket of money. So once they get enough people who applied for it, if you can apply for it, even if you qualify for it, if you're late to the game, you can't get it.
Gotcha.
Yes. I don't know why. 1 + 1 = fish. That was
it. I was going to say that was it.
Was that question 15?
You only had 14.
I only had 14. I remember what question 15 was going to be, though.
What was it?
Question 15 was going to be, what is your favorite place to learn about Medicare news and updates?
Oh, I love that
Your
question.
favorite place to learn about Medicare news and updates. It's right there.
By us.
Right here.
Qualified disabled working can be someone who receives Medicare because of disability but can still work. Think Down syndrome, severely autistic.
Thank you. Thank you. And yes, where is your favorite place to receive Medicare knowledge updates and the prettiest co-hosts?
The Medicare
Cafe.
That was part 1. I don't know if you guys noticed.
Yes, so that was.
Next week.
No, you go ahead.
Next week, part 2.
Next week, part 2.
Get ready.
Have more questions. Make sure you're studying. Make sure you look up your stuff. But yes, guys, that was
I'm glad you thought it was fun, Stacey.
On the Medicare Cafe. I had a good time doing it because, again, for me, like I will be the first to admit, I had to research and look up most of those questions because even when I do like an agent training, if we do like our Medicare Quick Start or new agent school, for those numbers, I say like you need to know them as an agent.
Right.
Don't try to explain this to your clients because they won't pay for it anyways. Just know what they are. So like I am the first to admit that I'm just like I glance over it.
Absolutely, and especially because those numbers do change a little each year. It's hard to remember them.
Yeah, I would say don't memorize, but memorize where to find it. My point, what I just said, is I don't talk about Part A deductible, Part A premium. I do talk about B premium, B deductible. How deep do you go into like the numbers in your Medicare?
Like the copays?
Yeah, because for those
they ask
for like the skilled nursing, like their supplement or their Advantage plan is going to have a different copay, so they're really not going to pay that. So do you go into detail about that in your Medicare 101s?
Not in, like in the presentation
No, like
to a group or to the client?
like in a client meeting when you're explaining to them Medicare and like the difference between like a MedSup, Medicare Advantage, what Medicare is. Do you go into those
I
number
don't
details?
unless they ask specifically about, what are, like if they're asking how a MedSup covers. Well, what are, it covers 100% of the Part A copays. What are those copays?
Yeah.
Or if someone is worried about long-term care and they ask about long-term care, that's when I'll go over those and explain how the MedSup or the Advantage plan covers it, and how really it's not long-term care and why you need to have long-term care.
And let me guess, your doctors, lawyers, and teachers are the ones that you have to explain that to.
Yeah.
Always.
And accountants. Did you say accountants?
I didn't know. I've not had a lot of experience with that.
I met with an accountant yesterday, and she was with it.
Did she have a calculator and was crunching the numbers? I can't imagine. If you're an accountant, like I just imagine you always have the green hat on, a calculator, and a cigarette.
She was the kindest soul. Also, she was so precious.
I love it.
She was just very smart and well educated on Medicare.
Well, there you go.
Yeah.
Awesome, guys. So again, this has been part one of
this was
2
fun.
parts.
Thanks for all your
Medicare
participation
quiz.
today, too.
I will announce later today on Facebook. We will have some cool stuff to give away, maybe some Medicare mugs, things like that. We'd love to ship out to you. So I'm going to go ahead and look through all the comments and the text and see, who is correct and who we had great interaction with. I will announce that later on Facebook to let you know who won the prize.
Stacy said she's a CPA, and no, not all of us are bean counters.
Stacy, I am so just like illiterate. I'm just like, here's a label. This is where you are now.
Man.
So
I feel like you just have a whole different code. If you know the tax code, you have to know you have different coding in your DNA to understand the tax code.
I don't like it.
Year after year.
No. My husband and I, we started a foundation, and we actually hired, we have a lawyer who went and actually filed everything for the 501(c) or whatever. And I literally held the paperwork, and I was like, I feel dumb. I am not intelligent enough just to simply look upon the paperwork that is the tax codes.
That's why we're the Medicare experts, and they're the tax experts.
That's what we do here. Awesome, guys. So make sure you like us on Facebook so you can follow along what we're doing and know who won today's involvement and education and Medicare knowledge prize. Appreciate you guys for hanging out with us. Make sure you join us next Tuesday at 10 a.m. Central Standard Time for part 2.
Arnie says engineers, too.
Engineers. Oh, yeah, for sure. Engineers. Let's just list people who are smarter than me. Fine. If that's what we're doing, fine. Awesome. We appreciate you guys.
Thanks,
so
guys.
much.
See you next week, part 2.
Until next time, have fun.
Make money.
And give impeccable service. Thanks, guys.